So what are surgical options for snoring and sleep apnea? Again, it depends on what's going on with the individual, where the site of obstruction is. In order to treat snoring and sleep apnea successfully, one has to be able to breathe well through their nose. So if one is having nasal obstruction, perhaps they have what's called a deviated septum, or the structures on the side wall of the nose called the inferior turbinates are swollen. Often we'll do surgery to correct that. And the surgery is called a septoplasty and a reduction of the inferior turbinates. And the very least that an individual should expect from that surgery once they're healed is the ability to breathe well through both sides of the nose on a permanent basis without the need for medicine. Nasal obstruction is definitely a cause for snoring. We're supposed to say it's not a cause for sleep apnea, although in some ways it is. But the point is that even after surgery on the nose to resolve nasal obstruction, an individual still may have snoring and sleep apnea. If that is going on, the question is, why is it going on? Does a person have large tonsils? Is the roof of their mouth, the soft palate, elongated and possibly larger than it should be? If that's the case, there are procedures that can be done that reduce both the uvula, the soft palate, and as well we can remove or reduce significantly in size one's tonsils. In some people, the base of their tongue is just very, very beefy and large. And there are procedures that can be done with a variety of technology that can reduce the size or the bulk of the base of the tongue. And that often will help with snoring and sleep apnea. And there are actually times when this can be done via an in-office procedure.